So I think you can expect to see me fighting for healthcare in every aspect. One of the things that I talked about prior to the pandemic happening was, addressing surprise billing practices and the high costs of prescription medicines. It's
Hmm.
impacted my family personally, and I can say that in sharing those stories, a lot of other people, shared with me that they had the same experiences. But it's about taking it even a step further. The pandemic happened and people began to lose their jobs, and then they lose their employer sponsored healthcare with it. So
Yeah.
now, there are a lot of people all over the country right now who are stuck making the decision of, do I go get needed healthcare and possibly go bankrupt over it? Or do I avoid getting healthcare and continue putting food on the table?
Hmm.
That is not okay. Those are decisions that none of us should ever have to make. You shouldn't go bankrupt for getting healthcare, needed healthcare, because healthcare is a right. Vice President, Biden said it last night during the debate. Healthcare is a right. And I fully and firmly believe in that. So I want to move to protect it. I think the first thing that we can do that's quick, easy, and I think everybody can get on board with, if it, most everybody can get on board with, is really enshrining Affordable Care Act protections into Pennsylvania law. That way, no matter what happens in DC with the Supreme Court or anything else with the Affordable Care Act, here in Pennsylvania, you will still have pre-existing health conditions coverage. You will still
Hmm.
have the essential health benefits. You can stay on your parents' health insurance through the age of 26. All of those pieces here in Pennsylvania would stay in place. That's what we need to do. That's quick, easy like that. I want to move to help create a public option so that if you're in crisis in your life or whatever else it might be, maybe you just don't have a job that's offering great insurance, there's a public option that you can have access to health insurance, a quality health insurance that's affordable. But to even take that another step further, something else I've recently started talking about is, I've been saying doctor deserts. I don't know if that's a real term or if I'm making that up here, but we know that in rural communities, a primary care physician or even a hospital may not be easily or readily accessible. We also have those same problems happening in urban areas in the cities, and more urban areas or suburban areas where maybe it's communities with low income and doctors aren't as inclined to open up shop there. So what do? We have an urgent care facility where people are going for instant needs instead of going to a primary care physician that has all of their health history to be able to
Hmm.
diagnose or determine perhaps there's something greater going on here because there's a history of something.
Hmm.
So those are things that I really want to work on when I'm in Harrisburg. How do we incentivize, doctors to be in these types of areas, these doctor deserts, as I'm saying, or, making sure that there's insurance to cover when people need to go see a physician and to be able to get that regular healthcare coverage. And it's insurance coverage that is affordable and accessible.